Recently, I've had a lot of typically men in their 30s, 40s, and 50s ask me about testosterone. Seems like there's this renewed interest in having good testosterone levels. I think that's probably happening for a couple reasons. I think people are typically trying to demand more of themselves, sleep less, work harder, work more, be productive, and they start feeling tired. And so one of the things that happens is now they check testosterone a lot. There's testosterone clinics and things around. So we check testosterone levels. And not surprisingly, in those men with symptoms of fatigue or low libido or low lean muscle, their testosterone is low. And one thing you can do is replace that testosterone. Typically, you're going to get that testosterone level up if you give someone testosterone. Of course, that's the goal. There's a couple things that I really try to ask people to keep in mind with that, though. So, as we're looking at testosterone levels, we're looking at free testosterone and we're looking at total testosterone. Total testosterone, typically in your average age male, is going to, you're going to want it to be above 300. So 300 is that magic number we typically are looking at. Below that's abnormal. Above that is in the normal range. Of course, really what we're going for is symptom improvement. Um, and so if I get a testosterone level in someone, I'm looking at typically 3 measures at least, maybe more: total testosterone, free testosterone, and one called SHBG. SHBG typically will fluctuate, and it will fluctuate actually for a number of reasons, but one big one is stress and sleep. So when there's high cortisol or low sleep, SHBG will rise. And what SHBG does is, as the name, serum hormone binding globulin. So it's a protein that binds many things, one of those being free testosterone. So when the free testosterone binds to SHBG, it's not available. So now it becomes unfree or becomes bound. So even if your total's high or good, your free might be low because it's bound to SHBG. So rather than maybe jump to giving testosterone replacement therapy right away, one of the things to consider is seeing if we can improve the things that got you there in the first place. And so we look at sleep, we look at stress management, cortisol levels, and see if we can adjust cortisol and adjust SHBG, see if we can get a little bit more of that total testosterone freed up to make it more active.